Hi everyone, thanks for coming along to hear me speak about what essential tools we can equip leaders with to support employee mental health, and importantly, the evidence to support this. So I'm a postdoctoral research fellow at the Black Dog Institute, which is the only medical research institute in Australia that investigates mental health across all ages, across the lifespan. We adopt a knowledge translation model, meaning we take our evidence-based tools and roll them out at scale rapidly to help communities, and for me, workplaces. So I'm part of the workplace mental health research team, where we investigate the link between work and mental health and what interventions and tools we can implement in workplaces to support employee mental health. My particular area of research is manager training, and what I look at is how we can train managers and better equip them to support employee mental health, and what benefits this brings to the individual employee, to the team, and to the whole organisation. Now, most of us, if not all of us, have at some point along our careers been part of a team and reported to a manager, probably more than one. And through these experiences, we know firsthand that not all managers lead equally. So when you reflect about the different leadership styles that you have encountered in the workplace, what differentiates leaders from the ones that have been supportive and made a positive difference to your career, and those who didn't? Were they approachable, available and easy to talk to? Did they provide constructive feedback, and were they open to receiving the same? Were they supportive of your career aspirations, but also of your own needs, your mental health, your needs as a carer? Did they provide adequate resources for you to ensure that you were able to carry out your job efficiently and effectively? Did they manage conflict in the workplace and other issues quickly and rapidly and fairly? So it may have been some, or it may have been all of these that these managers adopted in their management style. And in doing so, that manager was addressing some of what research has identified as work-related mental health risk factors, or psychosocial hazards, which are factors present in the work environment that can cause harm, including psychological harm. And you can see from this slide here that these work-related mental health risk factors can be categorised into three different groups. So those relevant to the individual job level, the team, and across the organisation. And we know when these risk factors are not managed effectively, then it can impact on the mental health and the well-being of employees. So most of these risk factors are modifiable, and there are a range of strategies that can be implemented at various stages of what we call the mental health journey, when workers go from being healthy to on a period of sickness absence leave for mental health reasons. Strategies may be reactive, so responding to workers who are already unwell or symptomatic, or preventative, so removing or minimising the work-related mental health risk factors for all workers. For managers, this involves a number of strategies. So starting at the primary prevention end, we've got developing work or modifying work to minimise harm. Then there's also building organisational resilience through good management, being able to initiate conversations, being able to role model accepting behaviours. We've got promoting and supporting early help seeking, knowing what resources are available for employees that you can inform them of, providing time off for them to attend appointments. And then for those who are on sickness leave, looking at ways that you can support their recovery, perhaps with graded return to work or modified duties. And these strategies are important for managers because managers play a key role in the mental health and the well-being of their staff. We've published observational data that has shown a really strong relationship between levels of manager support and levels of psychological distress amongst employees. So you can see here in this diagram, the more supportive a manager is, the likelihood that the employee is experiencing psychological distress is lower. And this is because managers are in a key position where they can make decisions and implement changes to processes that can impact on mental health at work. When these risk factors are managed effectively, we see better individual health and productivity. So this is an example of the individual health. We also see a reduction in absenteeism, and across the organisation, morale and performance is boosted. But managers often report uncertainty on how to best support the mental health needs of their staff, which has prompted workplaces to provide training for managers. But not all training is equal. And this has prompted investigation by research teams such as mine into what programs are best to upskill managers. So our programs that we develop and we evaluate at the Black Dog Institute target the strategies that have been found to be important for managers and leaders in supporting employee mental health, with the aim to increase managers' confidence and their application of behaviours and strategies around these strategies that we have found to be effective. Our observational data has shown that confidence is a key predictor of manager training. And this makes sense. The more confident you are, the more likely you'll engage in a behaviour. And our research has also shown that in order to facilitate long-lasting behaviour change, that we need to go beyond just psychoeducation, with skill development being a vital component of manager training that aims to equip leaders with these essential tools to support employee mental health. So we set out and developed and evaluated what we called the Respect face-to-face manager training program. This was a 4-hour program designed to help managers and leaders better respond to employees who were symptomatic or unwell due to mental health reasons, so focusing on these reactive strategies. Respect aimed to increase managers' confidence in dealing with stress or mental health matters amongst their team, responsive behaviours towards staff, so initiating conversations about mental health, and reducing work-related sickness absence amongst those that they managed. We partnered with Fire and Rescue New South Wales and evaluated this training through an RCT. So half of the group received the training, the other half received training or support as usual. And we followed everyone up, comparing baseline data to 6-month follow-up data to see if there were any differences that could be attributed to the training. I'm just going to show you a quick video, and this details the key messages that the training covered.
The 7 respect steps are your go-to guide when making a welfare call to an employee on leave for mental health reasons. Step 1. Make contact regularly, at least once every 2 weeks. Step 2. Get in contact early, ideally as soon as you're informed about their leave and the reason for it. An early contact, even if brief, shows support and will make staying in contact and facilitating their return to work easier. Step 3. Show concern and be supportive. Some people will be happy to hear from you. Others may feel a bit defensive, so you may need to be ready for a range of responses. The key thing early on is just to let them know that you're going to be supportive and able to help. Step 4. Don't play the role of therapist. Just listen, acknowledge what they've said, and offer practical help where possible. Step 5. Ask if they've considered getting help from a health professional and encourage them to do so. If appropriate, you can remind them about the help that your organisation may be able to provide. Step 6. Try to gauge how they feel about returning to work without putting pressure on. Discuss any adjustments that could be made to make things easier for them. And finally, Step 7. Let them know you're always available to talk and establish a plan to keep in regular contact. Remember, your ongoing support and reassurance can play a vital role in your employee's recovery and successful return to work. These calls can feel a bit stressful to think about, but they'll definitely make things easier in the long run.
So through the Respect face-to-face training, managers were provided with the opportunity to practice these steps through case studies and role plays, which the feedback showed were really valuable components of the training for the managers. And what we found when we evaluated the 6-month follow-up data was that confidence in the intervention group, so the managers who received the training, in their confidence in dealing with stress or mental health matters amongst their staff increased. In the intervention group, they were also more likely to contact a staff member who was absent due to mental health reasons, so initiating that conversation. And we also found an 18% reduction in work-related sickness absence amongst workers who were managed by those who completed the training program. And when we weighed up the costs of the training against those costs of the sickness absence leave, we found a return on investment of $10 for every $1 spent. Now, this program has become a core component of fire and rescue manager training and is also available through the Black Dog Institute. But in response to recommendations for a more integrated approach to manager training that encompasses both the reactive and the preventative strategies, we developed Head Coach. So Head Coach was an online training program that covered the Respect steps, but also integrated some preventative strategies for managers. Managers had 6 weeks to complete the program at their own pace, and the case studies, as was with the Respect program, and the resources available in the training program were all industry informed. So we worked in collaboration with the 3 industry partners that worked with us on this evaluation to ensure they received content and information that was meaningful to them. And then actually the video that I showed was developed as part of this program to I guess, highlight these key messages. Also, that there were opportunities to work through examples and case studies to, in a sense, mirror the role-playing experience that you can't have on an online training program. But what we aimed to do was, again, increase managers' confidence and also their responsive and preventative behaviours. As I said, we partnered with 3 industry partners on this. There were 2 state ambulance services and 1 building and construction. Again, we conducted this as a randomised controlled trial where half received the training and half received the training once all of the data had been collected, with data collection points at baseline, 6-week and 4-month follow-up. And what we found following the training was increased rates of confidence amongst the managers in the intervention group. That's the blue line in each of these diagrams, as well as their responsive behaviour and their preventative behaviour. And this increase, or this change, was maintained at 4-month follow-up. So we've gone on to partner with other high-risk industries, including physicians, where we adapted Head Coach specifically for their industry across Australia and New Zealand. We rolled this out in all hospitals. And there's some of the feedback up there that we received, which was really positive. We're currently working with New South Wales Police and also nurses in Victoria. And one of the lessons that has come out of the nurses in Victoria was a neat example showing how one of the nurse unit managers was able to have a conversation, knew the questions to ask their staff, and it became apparent that there was a lack of machinery that their emergency department needed, and they were able to take this to higher management, have these machines ordered, and reduce the negative impact that having a lack of resources available had on their staff. And just quickly, the WHO guidelines for the mental health at work were released last September, and the research coming out of our teams has informed the recommendations that evidence-based training should be made available to managers to help them increase their knowledge, their attitudes, and their behaviours towards mental health in the workplace and support staff. They're freely available online. So just in summary, good management is a key component to creating a mentally healthy workplace. Manager behaviour is modifiable, with promising results for evidence-based manager training that involves skill development. These programs can provide managers with essential tools to help support the mental health needs of the staff that they supervise. If you're interested in learning more about how your workplace can equip your leaders through evidence-based mental health training, the Black Dog Institute have a stand, number 18, and our staff would be delighted to speak to you to see what options are available. I'd like to thank my team, the funders and the industry partners that make this research possible. And they're my contact details, or I'll be around for the rest of the day. Thank you.